Doctor, what is AMH test and why is it done?
Ovary reserves are assessed by a test called Anti-Mullerian hormone. In conventional language or in the doctor's language, it is also known as AMH hormone. This is done to check how much of reserves are there for a woman. AMH hormone is a beautiful hormone which is very accurate and it has no day-to-day variability and it can be done any time of the menstrual cycle. In a normal situation, ovary reserves can be assessed by, in the earlier days, on the second day of menstrual cycle, the FSH hormone, the LH hormone, and the estrogen levels were checked. Subsequently, with the advent of anti-Mullerian hormone, the whole context of ovarian testing has become simpler, and the main reason for it becoming simpler is it can be done any time of the day and any time of the menstrual cycle. Unlike in FSH hormone, where it should be exclusively done on the second day of menstrual cycle, this can be done in any point of the time. The second aspect is, after the first and the second generation tests and the current generation of AMH technology, the test has become very robust and repeatable, and qualitatively and quantitatively its accuracy is very high. This is also known as positive predictability and sensitivity and specificity. The normal anterior Mullerian hormone levels are between 1.5 nanograms per ml to 5 nanograms per ml. If a person has less than 1.5 nanograms per ml, then they are considered on the lower side of the anti-Mullerian hormone, and in that situation, they should not delay the pregnancy. If their anti-Mullerian hormone is less than 1, then they should not postpone their pregnancy not more than 6 months to a year, because it will make a huge difference. When the levels are less than 0.6, then it's a real crisis, in which situation the number of eggs we get during the IVF treatment become very low and the treatment gets compromised. So anti-Mullerian hormone helps us to understand what is the current status of the woman's hormone reserves, how much time is there, and whether early decision for assisted reproduction should be taken. Sometimes anti-Mullerian hormone is also used in few situations to diagnose a polycystic ovary. That criteria is not universally accepted, but if the anti-Mullerian hormone is more than 5 nanograms per ml, in that situation, there is a high possibility of polycystic ovary. The reliability and the repeatability of this test has few exceptions. If it is done immediately after delivery, the levels will be low and it should not be taken. If it is done after an ovarian surgery like endometriosis, again the level has reliability issues. The third is, after you give gonadotropins, and if you measure AMH during that level, then you might get a false levels. The fourth, but not the least important is, but the most important is, if a woman is using an oral contraceptive pill, at least wait for 2 or 3 months before you do an AMH level, otherwise it gives a false level. The other parameters which can help to collaborate with AMH is also known as antral follicle count, which you are doing in the ultrasound. So in the current era of this decade, the golden standard of measuring ovarian reserves is the anti-Mullerian hormones, and sometimes a combination of antral follicles count and AMH gives a very accurate status of where things stand. So whenever you have an AMH test, It is telling you where things stand, and this will help you to speed up your decision in terms of certain situation.